Region 9 has 113 active cases of COVID-19, with 36 in the town of Lethem. In Lethem, the Mayor John Macedo and Deputy Mayor Deborah King have raised concerns that positive patients are leaving the isolation facilities to meet with others in the town.
In the afternoon, I observed people on both sides of the fence communicating with one another, which is really dangerous for Lethem. You need to have better security, right? The fence is not perfect there, and we need to do something with that fence urgently, right? And persons are leaving that facility and mixing with the residents.
There should be a guard there. If somebody comes there, they have to meet with a guard, because from the radio station, the regional guest house that houses isolation or quarantine persons there, the gate is open, it's very welcoming, and anybody can drive in and anybody can mix and mingle with them.
The malaria building, the regional guest house, and the facility at the Lethem Regional Hospital are used as isolation facilities, while quarantine patients are kept in a hotel in the region. The mayor and deputy mayor raised concerns during a meeting with the regional health officer, Dr. Niall Utman, head of the Civil Defense Commission, Kester Craig, Minister of Local Government and Regional Development, Nigel Darmlal, and Minister of Armed Affairs, Pauline Sakai, on Tuesday in Lethem. The ministers visited the region to meet with the COVID-19 task force to discuss what is needed in the region to tackle the disease. In response to the concerns, Craig said the regional task force will look at that as a priority.
There is a significant threat to life, COVID-19, and we have to get that message out to the population. I know initially when COVID-19 impacted Guyana, Region 9 was one of the regions that had all the measures in place. So to me, it's a position whereby people become complacent. And we need to restart that campaign so that people will be aware of the seriousness of COVID-19. Apart from that, where the security challenges are, I'll ask the task force to look at the priority, because you have to contain and stop the spread.
He further called on the private sector to assist in tackling the virus. Minister of Local Government and Regional Development Nigel Darmlal, in his closing remarks, also committed to having the issues addressed in a faster manner. He further disclosed that the Prime Minister, Brigadier Retired Mark Phillips, has established a cabinet subcommittee including himself, the Armed Affairs Minister, Minister of Public Works Juan Edgel, and Minister of Human Services and Social Security Dr. Vindhya Prasad, to tackle the spread of the disease.
We have to get this very quickly. This is actually going to be worse than Region 1, because you live almost in, well, the Brazilians almost live here, right? And Brazil, 20 million cases up to yesterday afternoon worldwide. Brazil is the second most devastated country. So it's not something for us to play around with. It is not something for us to talk about over and over again. We have to get out and get the work done.
12 indigenous villages have so far recorded COVID-19 cases in Region 9. On Tuesday, the government donated 520 hampers and over 2,000 face masks to tushos and community leaders in the region to aid households that are affected by the COVID-19 pandemic. The Minister of Armed Affairs said items will be given to the residents so that they can do what is necessary to protect themselves.
I think the CDC has some plans to provide some of the the sanitizing hampers. We hope that we could, at some point in time, provide those level of support to the Amerindian villages, because you are more aware than most of us that some of these items are basically almost non-existent in some of the homes. So it is important for you to continue to ask the village councils to continue their propagation of the protocols.
According to the regional health officer, 404 persons were tested in the region so far. He noted that one of the major challenges is getting results in the region in a timely manner. In the interim, the National Reference Laboratory in Georgetown has begun sending the digital copies of the results before the hard copies. Dr. Uthman also reiterated the concerns with persons traveling from Brazil, which has recorded the second highest number of cases globally. He revealed that there are 25 crossings in the region, and this is hard to monitor. The regional commander, Superintendent Keaton King, told the meeting that he has requested additional resources through the deputy commander administrations. Bibi Katun, Newsroom.